Aging is a process that impacts women suddenly during menopause, much before men, and they tend to have a decline afterwards after menopause. On this note, I would like to call upon a senior gynecologist and the charming lady of our organization from Jullundhar, Punjab, to talk about aging gracefully in menopause. Please welcome Dr. Sushma Chawla for the following talk. Thank you.
A very good afternoon to all of you. I'm Sushma from Jullundhar. I bring greetings from Chawla Nursing Home. And here I have a flag every day, which is hoisted every day. That gives me a lot of strength to do something for my country, something for the women, something for the community. So I'm mainly a hysteroscopist, laparoscopist, and my main interest is also in menopause. I started Menopausal Society in Jullundhar and the Club 35, thinking that one day everybody needs it. This is my passion. That is a ribbon movement. I carry it anywhere I go, whether on the train or a plane or on the road. So this carries some small messages which I want to give to you. This yellow ribbon is significant for the menopause, that we need to look after the people who are aging. The white ribbon, all these ribbons are directly or indirectly related with the old age also. White ribbon is for women empowerment. If every lady is working, earning, and having something in her pocket, then of course she can look after her old age. She doesn't have to beg and borrow either from the parents or from the children. This red ribbon, only yesterday one of the senior colleagues sitting here told me that sister of one of our senior gynecologists was murdered at home. And this is about what people can do when they drink, when they smoke, then they have sex, extramarital relation, they have vague ideas about the life, and self-defense is very important. And this ribbon is, you all know about the AIDS and sex abuse. Since I was working as a JJ member for adolescent children, I found that so many children, they need education for it. And this also directly, indirectly, we as aging society, we need to go to the children and, spend some time with them and tell them sex education also. This mauve ribbon is for the people who want to work for society, and this is for adolescent children. This is, you have to be friendly with the children in your own family, and maybe you can run with them, you can dance with them, and stay young with them. Breast cancer. This all over the world, people know that pink ribbon signifies the breast cancer awareness, breast self-examination, and, one checkup a year for the breast from the doctor, maybe sonomammography or mammography is a must. That by the time we are menopausal, we are not suffering from the cancer. And anyone you talk anywhere, somebody here or there has breast cancer. Every fifth woman is for the breast cancer. Green is for the environments. Why we are aging fast? Because whatever we are eating is not natural, it's not organic, and half the disease we are getting from the things which will go inside. And blue ribbon, in case we get immunized when we are young, maybe even 9 to 24 years and less than 26 years, all boys and girls, and the women less than 45 years, if they get, immunized for cervical cancer, HPV, the cancer incidence in menopause will also decrease. So this is my passion. I carry these ribbons everywhere and wear one ribbon every day and give to my patients also, so they can educate their own families in their village or other family. So what is menopause? Menopause is a transition phase from reproductive to non-reproductive phase in a woman's life. Today, we are aware that menopause has much wider implication than simple loss of fertility. It sets the stage for aging and accelerates the process of non-communicable disorders. Natural menopause occurs when you have stopped producing the hormones that cause your menstrual period and have gone without a period for 12 months in a row. What are the signs, symptoms of menopause? Vasomotor symptoms. Many ladies, they get up right at midnight, they have hot flashes, they have sweating, they go out of the room, even in winters. And that causes a lot of distress in women. The cognitive factor, you must be knowing, you've forgotten where you have kept your keys. So many things we don't remember. Vaginal dryness, this is something which disrupts your personal life. Urinary complaints, just now we were talking, frequency of micturition, burning micturition, stress incontinence, urge incontinence, they are all associated with the aging process. Mood swings, half the people, they are distressed. Either the mother-in-law is fighting with the daughter-in-law, or the mother and the daughter, they are fighting. So even irritability goes because of the lack of hormones which are, disappearing in the age. Estrogen keeps you very happy. The HRT or menopausal, hormones, if you keep on taking, you stay, happy. Once I stop hormones, my son can, Mommy, you stop your hormones, it looks. But there's the age when you have to take it, there's the age when you have to stop it also. The uterine bleeding. This is another thing which happens when you are menopausal. In case you get the postmenopausal bleeding, we have to take care whether it's the vaginal bleeding, it is from the cervix, from the body of uterus, and it has to be tested. So this is the age when you get, so many people, they get cancers. So we have to be aware of the TVS and abdominal scan, pap smear, and colposcopy, which can detect cancers early. Skeletal-muscular problem, everybody is discussing. If you go to any Gurdwara and Mandir, half the people cannot get up. They have arthritis, they have osteoporosis, they have, fractures. So this is right at the age of 35, we have to start thinking what is going to happen at the age of 100 years. So we have to do lifestyle modification. The sleep. Your husband is sleeping and you are getting up, moving around, because just now I was discussing people, they say, I don't get a good sleep. So why it is so? Because of the lack of hormones. So when to give hormones, when not to give hormones, you have to come a gynec. They'll assess and take your history in detail, when to give, how much to give, when not to give. So the quality of life. It is a global quality of life, refers to an overall sense of well-being beyond the presence or absence of symptoms. It also determines how the woman feels about her interest in life, ability to complete a day's work with satisfaction, maintenance of good interpersonal relationships, sexuality, and general feeling of well-being. Management. Quality of life is an important aspect which should be taken into consideration while evaluating and managing a woman at or beyond the menopause. Reinforcing a healthy lifestyle, incorporating enjoyable and relaxing activities will add immensely to the quality of women at menopausal transition. So what happens when any patient comes to me? She is accompanied by mother, mother-in-law, or grandparents. So I give this performer to them, and at their leisure, they fill it in. And this is the way I can do social work. I treat my patient who is pregnant or going to deliver, but at the same time see her mother and mother-in-law also. This is the question for awareness. So aging gracefully in menopause, what is the meaning of grace? It is just showing off, or it is your internal grace. Living gracefully refers to navigating through life with a sense of ease, wisdom, and acceptance. Unveiling inner grace. A lady, she's 86, and when she was photographed, she did not know that she is being observed. She's so busy in her business. On one side, she's got the newspaper. On the other side, she's got her water. On the other side, she's got her biscuits and something to drink. And she's earning while at home. And she's 86 years. She's my elder sister. She's in Bangalore. Even now, she's busy. When I go and meet her, she has no time for me. She says, okay, meet me at 8 o'clock in the evening. There's another lady sitting here. I was in Meklotganj and very independently going for prayers and coming back. So we eat healthy for our heart to lose weight or even prevent diabetes. So what about her brain? Let's learn how to identify simple and gradual lifestyle strategies to keep our brain healthy for aging gracefully. I'm going to make you do some exercise, be ready for that, so that you also age gracefully. It is important to have a twinkle in your wrinkles. You are as old as you feel. It is not that you look, you always have a child in your heart. So keep on doing whatever you feel like doing. So why worry? If worries can cure your sickness, then go ahead and worry. If it prolongs your life, or if it can exchange for happiness, then go ahead and worry. Don't worry, be happy. Worrying, stress will only make you age a lot faster. At your age, you will know things will happen at their own time. So take it easy, breathe easily. Take a moment to appreciate the smell of your morning tea or coffee. Go for a walk, talk with someone. Happiness is not a gift. It is not a given talent. Happiness needs to be pursued. So I will let you do some activity. And I asked the counter people there, hello, can you put something? I'll make you do something, right? You have to move your joints, your fingers, do with me. So follow me, whatever I do. You know, hello, hello. It's not working, hello. So what we need, we say, age gracefully. We have to do yoga, we have to do exercise. So when I say you get up, then you get up. Otherwise, what I'm going to do, you also do it. Move your fingers first. Move your wrist. Move your elbows. Move your elbows. Move your wrist up. Now we'll do it with the music. Okay? Yeah. Okay. So kindly put the music, because lecture you have been already listening. This is for your mind, body and soul, for your bones, for your heart, everything is for.
रफ्तार से चल पड़ी जाते हुए राहों में हमसे अभी कह के गई हमारा ये वक्त हमारा जो एक बार गया तो आए ना दोबारा समझ लो जरा ये हवाओं का इशारा मेरे यारों अपना हर दिन ऐसे जियो जैसे कि आखिरी हो जियो तो इस पल ऐसे जियो जैसे कि आखिरी हो अपना हर दिन ऐसे जियो जैसे कि आखिरी हो जियो तो इस पल ऐसे जियो जैसे कि आखिरी हो Living every moment and we're having a blast singing oh eh oh oh living every day like it's your last singing oh eh oh oh living for today letting go of the past singing oh eh oh oh give it up everybody sing oh eh oh oh हम सब जो साथ में रहे खुशियाँ सब हाथ में रहे हमसे बस फासले रहे हर दूर चाहे कहीं भी किसी भी मोड़ पर बिगड़ेगी कोई बात भी अगर मिलके एक दूजे से कहें ये बातें छोटी मोटी बातें ये आए जाए जैसे कि दिन और रातें ना आँखों से लगाना कभी ये बरसाते मेरे यारों अपना हर दिन ऐसे जियो जैसे कि आखिरी हो जियो तो इस पल ऐसे जियो जैसे कि आखिरी हो अपना हर दिन ऐसे जियो जैसे कि आखिरी हो जियो तो इस पल ऐसे जियो जैसे कि आखिरी हो
I think that is the essence of life. Enjoy life, live life as much without any fikr, without any care, just enjoy. And that is the way you can age gracefully. Thank you so much. So,
and chairpersons, please, comments and questions.
right.
Thank you, Dr. Sushma, for a wonderful session where you stimulated not only the mind, but the body also. Now, when we talk about aging, and we take 100 years as our lifespan, and I am reminded of a book, the Bhagavad Gita, abridged version given to me by my father when I joined pre-medical more than nearly 50 years ago. And the moment I read some few pages and there was talk of 125 years, 150 years, 200 years, I left that book aside and said, all this is useless. Let me concentrate on my pre-medical. And for the next 15 years, I didn't pick it up, only to pick it up later. And now I feel that we should redefine our lifespan. And when we talk about our lifespan, because I noticed one thing, that a couple of people whom I knew, when they reached 100, or for that matter, even you look at Morarji this side, 99, Soma lag gaya. The mind is programmed. Soma lag gaya, mission accomplished, now it's time to go. It isn't. I think we redefine it and make it 125 years so that we live a much healthier and longer life than ever before. Thank you very much.
Hello. I just want to say that crux of all the problem is reproductive organs. For the menopause, for the andropause, sexual dysfunction. So it is the total genital tract where sexuality is hidden, including breasts. Now, I just wonder, when do we start aging? Do we start aging from birth? No. I think when we become reproductively active, like in adolescent age, perhaps from there we should start counting aging. Because from there we have to control our lifestyle. What do we eat? How do we live? How do we enjoy? We don't smoke, we don't do tobacco, we don't do extramarital or all wrong things sexually we should not be doing. That will lead to a healthy life. And the diet and the nutrition. We try to go to the Western restaurants, eat pizza, burger, enjoy late night sleep, no early rise, no sun sitting, all the time rubbish things we do. So healthy aging starts right from puberty or adolescent when we are ready to get married or sexually active. The whole life we have to look after our health. And at menopause, of course, that time. But menopause depends on how we have behaved earlier. Have we become obese? Are we overweight? Do we have diabetes? Do we have hypertension? Do we have hernia? Do we have so many things? So my request is, healthy aging is not from just the menopause or andropause. It starts from adolescence or from the time you are sexually ready to get married and lead an active married life. Production of children, no childbirth, extramarital or pre-marriage sexes, they lead to so many type of infections in pelvis, and that leads to ill health continuously. Rapes, murders, all these fears, loss of parents at childhood, you become orphan. So all these things matter. Thank you.
Thank you, Dr. Kacha. But one message is that please look after yourself. Think of your birthday, maybe wedding anniversary, or maybe the new year. Get head to toe your checkup done for everything. with the eyes, your skin, your denture, your heart, your ECG, your pap smear, mammography, everything needs to be done so that you remain healthy. But whatever comes, age ultimately has to give you certain diseases. You have to fight with them. Stay happy.
Thank you, ma'am. I will ask the chairpersons to give a token of appreciation to Dr. Sushma Chawla, ma'am, for her lovely talk. And probably doing that, I felt like I was 20 years more elder. I couldn't do many movements in that. Thank you, ma'am. I would like Dr. Rakesh Taneja sir to please wait. We'll give you a green welcome before leaving.
I know, small.